Hey ladies and gentlemen, if you're into eye stuff, this might be the episode for you. Let's join Robbie and his crew in this eye-opening episode of Pitt. Is that a pencil in his... Oh my god, that's a pencil in her ear.
Show her. Show her.
Whoa. Okay, yeah, he needs to come in. Come on, lady. Yeah, eye injuries are sort of the same class as what we'd say life or limb threatening, and they get bumped up the queue. They need to be seen right away, especially if we suspect there's been any sort of damage to the globe. I don't know how that happened. Was he wearing a baseball?
Come around to the double doors.
Well, we'll see how he sustained that injury. Was he hit by a baseball bat? I don't know.
Who do we have the pleasure of meeting this afternoon? Everett Young, 16, took a line drive to the left eye. Tucky at 118.
Ooh, okay, so he did take a ball to the eye. Wow, that's pretty dangerous. Yeah, I'm glad his father. I thought his father was just being a dick. Yeah, he was pre-writing, getting him rushed through. So you can see how that could have been missed in triage. He was just holding an ice pack to his eye. Maybe they thought it was just a small minor injury. A little bit of swelling on the forehead, but you got to take anything with the eye very seriously. It is your vision. You've only got two eyeballs, so you don't want to lose one just because you were fobbed off by the triage nurse or the receptionist, whatever.
4 of morphine, 4 of Zofran. Excuse me.
It's got some pain relief on board, some good old morphine.
It was easily 100 miles per hour.
Oof.
100 miles an hour. No, possibly, maybe, I don't know, 60, 70, 80 miles an hour, but 100 miles an hour? Buddy, no.
Did she pass out?
No, ma'am.
So no loss of consciousness.
Good. He's got a 95 mile an hour fastball, a 12.6 slider, a .94 ERA, and he's a southpaw.
What's that?
It's a left-hander. So, yeah,
I don't
okay.
know what that is either. Mr. Vadi is
Oh, poor girl. She doesn't know what a southpaw is. Okay, never mind. But yeah, look at that guy's eye. It's yeah. Let's have a look. Let's have a look.
a student doctor. She's a bit of a prodigy herself, actually. You mind if she helps out?
No, ma'am.
Okay.
It's a very polite young man.
How many fingers I'm holding up?
I can't tell.
Oh my God.
Okay.
Okay, so what they're doing is they're checking his vision with a very basic sort of visual assessment test. So they'll check for three things. They'll see if you'll shake your hand in front of him and see, do you see my hand? Then they will ask you to count fingers. Can you count my fingers? If you can't do that, okay. And they'll shine a light in his eye. If they can see it, or if he can't see it, then we'll say he's got perception to light or no perception to light. So yeah, it's a very simple test. Even you can do it at home if well, don't do it at home. Sorry. If you have any problems with the vision, go and seek a doctor, seek medical attention. But it's something you can do. All you need is a hand, some fingers, and a light source. Now let's see if he's got. He couldn't count the fingers. I was rambling on. I think he couldn't count the fingers. But can he see the light? Has he seen the light?
Tell me when the light turns on.
Now?
My perception only.
Okay, cool. So he's got perception to light. That's the extent of his vision. And they just call for a slit lamp or portable slit lamp. It's just a device that they can look inside through the cornea, through the transparent bit of his eye, and see inside. They need to assess the globe of his eye to make sure it's not damaged. There's no rupture. The globe is the actual eyeball itself. And they want to see inside as well.
Hey, Javadi, what do you think of the anterior chamber?
Hyphema.
Exactly. Grade 4.
Yeah, meaning?
Meaning, sir, he's got a hyphema. That is a collection of blood in one of the chambers of the eye, the anterior chamber to be more specific. So the eye has two chambers separated by the lens and the iris. The anterior chamber sits in front of the lens and the posterior chamber sits behind the lens. So he's got blood collecting in the anterior chamber. That might be affecting his vision.
Javadi.
Meaning blood is filling up the front eye chamber. He'll need an emergency evaluation by ophthalmology.
Is that why you can't see?
That's part of it. Yeah. You see how
Yeah,
your
possibly.
eye's pushing out? There seems to be a collection of blood behind the eyeball. The eye pressure's too high. We have to act quickly.
Okay, well, check the pressure.
We're going to right now.
Okay, so I couldn't see it myself, but looks like they're seeing his eyeball sort of push out, which is not a good sign. That means there's either something behind, which is pushing it forward, and in this case, because he's presenting with a history of trauma. He's got whacked in the eye with a baseball. There might be bleeding in the orbit, which the orbit being where the eyeball sits. We call that the orbit, the sort of the bony structure formed by the skull that houses the eyeball is called the orbit. And he's probably got some bleeding behind there, and it's what we call a retrobulbar hemorrhage. Retros meaning behind, and bulbar meaning the bulb of the eye or the eyeball, and the hemorrhage means bleeding, so it's a retrobulbar hemorrhage. So he's bleeding behind the eye. It's making his eyeball pop out. Probably won't pop out, but it's going to push it forward, and that's not good for a few things. But let's keep watching.
Can you get Robbie?
Get Robbie.
Look up at the ceiling for some numbing drops.
So they're putting a local anesthetic on the eye, some drops.
That's some drops of the fluorescein strip.
Did she go to college when she was 13? Oh, I feel sorry for her. I feel sorry for all these child prodigies. Yeah, it's really great you went to college at 13. That means, yeah, you probably are very smart. But I find, and I don't know if this is true, I don't know, I haven't seen any research, but a lot of the stories I hear, these are anecdotes, of course, a lot of these child prodigies, they don't end up being very balanced individuals, just because they're sort of accelerated through their education into adulthood prematurely. But anyway, I'm rambling. Let's keep watching.
I was thinking about California, maybe UCLA or USC.
Still?
Hey, maybe you can go straight to the majors, huh? College can wait.
I don't know.
Oh, that dad is an asshole. Pretty sure he's trying to live out his childhood fantasies through his son. Wanted to be a big baseball star. Come on, Dad. Your son's almost lost his vision because of this. Or he might lose his vision, I don't know. I'm pretty sure they'll probably save it. It's not Game of Thrones. Or is it?
I do. Ev's got a God-given gift. That's why we spent every weekend doing travel ball when he was young, pro camps, showcases. He's not throwing away his shot at the majors.
No, that's a depressing childhood, especially if you're not really into baseball. And the look on his face tells me he probably isn't. Anyway, it's a nice little dynamic there for the TV, but you get a lot of situations like that. Overbearing parents.
We have to check for the puncture before we can measure the pressure. Straight ahead and try not to move your eyes, okay?
Yes, ma'am.
Lights going out.
Hello.
Oh yeah, if you're going to use a slit lamp, you have to turn all the other light sources off, so there's no interference with the slit lamp. You'll be able to illuminate only the eye.
I'm Dr. Rabinovich. Everybody calls me Dr. Robbie.
Hey, Greg Young. This is my boy Everett.
Nice to meet you both. Okay, I will take that slit lamp and you can calibrate for telemetry.
Okay.
They're holding CT for him.
Ooh, that's a very fancy looking slit lamp. Things have probably changed since I last studied ophthalmology. It looks, nice. It's got a digital screen, so the ones I remember, we had a scope or an eyepiece and you had your machine. There's nothing like this. Oh, that's pretty cool. It's got like digital zoom and stuff. Nice.
Negative side out. No globe rupture. Okay.
Oh, good. So no globe rupture. I think I did see the hyphema. I'm not sure whether they showed it, but this is pretty cool. So I'm really liking this in the Pitt, is where they're combining sort of real life footage with the imaging that they're using, and it's possible because they're using all these advanced instruments like the glide scope we saw earlier. You're intubating using a screen, so you can actually duplicate the image from maybe previous patient or whatever, and put it on the screen, so it's actually a real image, and that looks like a real image. I don't think that's a model. Let me just go back.
Calibrate for telemetry.
They're
Let's
holding
go.
CT for him.
Let's take a look.
The one way you can tell is if it's blinking is matching, but anyway. But yeah, that looks like a real image.
Negative side
That really
out.
just looked like a real image.
No globe rupture. Okay.
And you can, look at that, look at that. So that, so he's taken the screen away, but you can see the image is still kind of the same. Now they did it quickly, so you wouldn't notice, but that probably was a real image from some other patient who's probably, I hope they consented for their imaging to be used on a TV show. Hope they got compensated as well. But that's pretty cool. But I did catch you out, Mr. Visual Effects Supervisor. I'll catch you in the credits. Could have done a better job. I could be wrong though.
Hold still.
So that's a tonometer. They're gonna measure the pressure on the eyeball. Yeah, that looks pretty uncomfortable because they're actually making direct contact with the eyeball itself. But he's had some numbing solution put in there before that, so hopefully it shouldn't be too uncomfortable.
Left eye pressure 58.
Ooh, yeah, that's high.
Yes, it is. 1% lighter with epi. Push 1% and open a lateral canthotomy tray. Excuse me.
What? Whoa. Without a.
Okay. So I think he said he's going to do what's called a lateral canthotomy, if I'm not mistaken, which would make sense here. It's a sort of a vision-saving procedure, which you do if there's an extreme situation where there's so much raised pressure behind the eyeball that it's going to damage his vision. So they'll essentially do what's called a canthotomy, which is this is the canthus of the eye, the sort of the angle of the eye. They'll make a cut there and a hole. They'll do a cantholysis, which will sort of make a hole into the back of the eye. Yeah, it sounds pretty gruesome, but it's just a small cut really. But it will save his vision. This young man, Mr. Everett, budding baseball pitcher. Sorry. He's not a pitcher, was he? Didn't catch. I don't know. Was he batting or pitching? I don't know. Anyway, it's gonna save his vision. So well, we'll see. I don't know. That's what I heard. I think I heard. We'll see.
Isn't that
Exactly what the patient needs? Yes, it is, Dr. McKinney.
okay? We're gonna lie you back, little Everett. Okay?
We need to do a little minor surgery to relieve the pressure behind your eye. So we're going to cut a small opening on the side of your eye.
Yeah,
In your eye. Got it? Yeah.
they're gonna do a canthotomy.
No.
Yes, I want to watch. Okay, maybe not Dad.
Dr. McKay, Chad is splinted. Is
I got a feeling a lot of the guys in here are not into eye stuff, and it can be quite squeamish. They're not going to do anything to the globe, but even then, needles near the eye, cutting into the eye. I mean, I've seen surgery done on the eye itself, cataract surgery and stuff. You get used to it, but some people just can't stand the thought of anything going into the eye. It's like a lot of medical professionals, they've got things they can't deal with. So, for example, I know some doctors, nurses who can't deal with anything like vomit, can't deal with stuff like amputated limbs, toes, feet in general, especially the feet you get in hospital, or patients who are old, don't take care of themselves. Some nurses just can't stand them. Me personally, I don't think I've got anything I really find squeamish. Don't like anything to do with kids. It's not squeamish. I mean, I'll definitely do everything I can to save a child's life, but that's just sort of emotionally distressing to me. But eyes are something that I find a lot of people, oh my God, I can't stand it, like Saw and Final Destination kind of stuff. But anyway, they're not going to go into the eyeball itself, onto the side. But that kid's going to be nervous as hell anyway, so I think they're going to give him some Versed, some benzos to keep him calm and help him forget it as well.
Versat's on board.
Yeah, cool.
Numbing medicine here, okay?
Okay.
Pinprick and some burning.
Oh, don't hold the needle like that. Oh, that's trolling. She was holding it like she's going to go in the globe. I think she's just trolling the audience. But I could be wrong.
So after you cut his eye, see again?
This will give us our best shot at preserving his vision, yes.
Okay, so I haven't seen a canthotomy or cantholysis recently. I think we saw it, or I saw it like way back and when I was in medical school. So what they're doing is, I believe they're crimping the angle of the eye. They'll crimp it for like 1 minute to sort of flatten that out. And then they'll cut into it and sort of clear the tissues away from the tendons or whatever. I can't really remember the exact procedure. It's not something you would see commonly being done. It's pretty rare, to be fair. Rare to be fair.
Okay, are you ready to do the honors?
Who, me?
We are a teaching hospital. Are you still here to learn?
Oh yeah. as a resident, yeah, you should be always jumping to learn new things, learn new procedures. And the only way you're going to learn in medicine, and as in other things in life, is if you do it. There's no better way to learn. And that's why you have a residency. It's an on-the-job training, apprenticeship, whatever you want to call it. In life, in everything you do, if you want to do something new, if you want to learn something new, no matter how many YouTube videos you watch, how many instruction books you read, the only way to really learn it is to do it. Just do it over and over again under supervision, so you'll know what you're doing, and they'll point out if you're doing something wrong, etc. But you have to do it. So never be afraid, ladies and gentlemen. Just do it. I'm going to get sued by Nike. Hang on.
Okay. You can release that hemostat now.
Yeah, so we'll keep it on for 1 minute and release it.
The length of the crushed area is going to be your guide for the length of your cut.
Oh, nice. They actually showed it. It looks pretty real. They've got the budget for the effects. Oh yeah, that looks really good.
Inferior?
So you can see the hyphema.
Inferior cruce.
How can you see with all that blood?
You can. It's all tactile. Feels like 2 guitar strings.
Medicine bomb. Inferior.
Yeah.
And superior.
Oh, nice, nice. Did you notice the eyeball actually started to retract backwards, and the eyelids were always open, but that's starting to come back as well. Well, that's pretty cool. Nice, nicely done. Nice effects. This the dummy. I'm sure it's a dummy. It looks pretty real. Even got the nose hairs and stuff.
Well, that's a lot of blood. Okay, let's get a repeat pressure.
It's getting a lot brighter.
Pressure of 18?
Nice. Nicely done. Nicely done. Well done. Cool. So they eventually got around to doing a CT of his head. So he's got a little fracture in the floor of his orbit. So that's sort of what the eyeball is resting on. So let me try and demonstrate. So maybe I can explain. Let me power up Microsoft Paint and see if I can get an image and describe what the hell was actually going on inside this young lad's eyeball. So okay, so we've got an image here. So this is a cross section of the orbit, and the orbit being, as I said, the bony structures holding the eyeball in place. So it's a cross section through his skull, literally. Somebody took a blade and just cut through like here, and this is what you're gonna see. Okay, so this is the eyeball itself, or the globe, what they're talking about. This is the transparent part of the globe in front, and this is the lens. Then you've got this bit. This is the anterior chamber, and this is the posterior chamber. So he had some blood collecting. So he took a massive hit here. Big friggin' baseball just hit him here, or maybe around here when they mentioned a fracture of the inferior, or the floor of the orbit, which is here. So he had a fracture, and there's going to be bleeding. And what happens here? Let's say over here, where it's sort of shown, he's got some blood collecting there. It's bleeding. And it's got nowhere to go really. There's no place to come out, so it's going to start pressing down on the stuff around it. Okay, so yes, it's going to exert pressure all over the place. Up here, back here, down here. So yeah, so this is bone. So the pressure exerted here, it's not going to have any effect on the structures here. Most of the pressure is going to be to around here on the eyeball. So what happens is the overall pressure inside here is going to increase as well, because it's being compressed. So you'll have increasing pressure here, all over. So that's not good. High intraocular pressure is what we call it, or raised IOP. And what we're mostly concerned about is its effect on the vision. And how will it do that? It'll sort of press on this structure here, this yellow thing coming here. So this is your optic nerve, and it's going to be connected to what's the retina, which will convert your light into nerve impulses, and that's going to be carried by the optic nerve to the brain. And this raised intraocular pressure, amongst many of the bad things that it does, it can damage this optic nerve, and that's how Everett might lose his vision and his chance at the major league. So that's that in a nutshell.
So he could be game ready by Thursday. Huh?
Oh, what an asshole! That's a bad dad right there. Your son almost lost his vision. He could have had a serious head injury as well, but all he cares about is the next game. Yeah. Anyway, I've seen enough, and I'm sure you've seen enough as well. Sorry, this is a bit short episode. I'm just finding it so difficult to find time to do these things. Make sure if you enjoy this video, please give us a subscribe. Make sure you like the video. Leave me a comment. Let me know if you think this episode was particularly interesting or was it boring, and what you thought of the canthotomy. And if you've ever seen something similar like that, or if you've ever been hit in the eye with a baseball at 100 miles an hour apparently. But anyway, yeah, have a little discourse in the comments. I'd love to hear from all of you. And that'll be it for now. Stay healthy, stay safe. See you there. See you in the next one.